Hello everyone, I'm王鹏from Chengdu University, School of Medicine. Welcome to the PBL talk show. The topic that we are going to discuss is the astrocytome. Now let's move on to this case. Imagine you are a neurosurgeon. A 28-year-old male patient comes to the hospital.
Doctor, I feel severe headache, similar to scratch in the scalp for 2 days. I also want to vomit. Moreover, recently, my memory is getting worse.
Firstly, based on the patient's description, we should first do a CT and MRI. Magnetic resonance imaging scan of the brain demonstrates a heterogeneously enhanced mass with the right front parietal and posterior right temporal lobe with surrounding vasogenic edema. Combined with the clinical symptoms, it is initially considered astrocytome. So what is the doctor diagnosis on astrocytome? Let's continue to learn about astrocytome. While preparing for the PBL talk show, I use the clinical student and complete autonomy to check relevant helpful medical information, including the latest authoritative clinical guidelines, videos, pictures, and many useful medical resources. I have been using clinical student and complete autonomy for 2 months, and I think these two learning platforms are very suitable for medical students because these two learning platforms can not only help us deepen our understanding of diseases, but also help us quickly access relevant literature and cutting-edge developments when we read papers. Astrocytomes are the most common primary glial tumors of the central nervous system, representing about 30% of gliomas. Astrocytoma is easy to recur. The reason is that the boundary between tumors and normal brain tissues is not clear, and it is difficult to completely remove it during surgery. It is more common in the cerebral hemisphere and the subthalamic ganglion area in adults. In children, it is more common in the supratentorial area. Next, let's learn the pathological characteristics of astrocytome. The diseased astrocytes show hypertrophy and hyperplasia. The cells are swollen, have large nuclei, and their characteristic structure are those fat fiber. The figure below shows the formation process of those fat fiber. The picture on the right is a schematic diagram of the three lesions of astrocytome and a pathologic section of astrocytome. Let's look at the clinical manifestations of astrocytome. The following are common clinical manifestations of astrocytome: headache, new onset partial or generalized seizure, nausea, vomiting, convulsions, hydrocephalus, or cerebral edema. Regarding the diagnosis of astrocytome, MRI is commonly used and authoritative in clinical practice. The left picture is a schematic diagram of some area of the brain with detailed annotations. No grade. Astrocytome usually presents as diffuse non-enhanced lesions, and many occur in the anterior lobe of the brain and the acidotic cortex. High-grade astrocytomes usually have increased heterogeneity, occur in the cortex, white matter, and are accompanied by significant peripheral edema. I know it is very hard to interpret the MRI, but why don't we try it? The right picture shows the MRI of the diseased brain of the normal brain, and I found it on the complete autonomy. Can you identify the lesion from the MRI image? They can be classified into degrees of malignancy according to WHO as panocytic astrocytome grade 1, diffuse astrocytome grade 2, anaplastic astrocytome grade 3 and TBM grade 4. Grade 1 astrocytoma is usually a tumor with a small spread. Complete surgical resection is the mainstay of treatment can cure this tumor. In grade 2 astrocytoma, post-operative PCV chemotherapy and radiation therapy can be used simultaneously to improve survival and overall survival rate. In grade 3 astrocytoma, surgical resection has been proven to prolong survival, and post-operative chemotherapy and radiation therapy are also frequently used. Recently randomized clinical trials have established survival benefits and chemotherapy for 6 to 12 months. In grade 4 astrocytoma, surgical resection can improve the major survival rate. Random trials have shown that concurrent chemotherapy and radiation therapy, followed by 6 months of chemotherapy with temozolomide alone, has survival benefits. Unfortunately, even with chemotherapy and radiation therapy, the 2-year survival rate for these patients is only 16%. How astrocytoma is diagnosed and managed can be put into this flow diagram. Hope you can enjoy my Pbl talk show and case sharing. If you have any question about astrocytoma, please send the email on 2021@outlook.com to me, and we can have a further